There is a male fertility crisis never before seen in history. Young, seemingly healthy, good-looking males are having trouble having children in their 30s and even in their 20s. What's going on? Semen quality is a parameter that correlates very well with your health. Poor seminal quality is linked to poor health. Normally, but you don't need to have a serious and chronic disease to compromise your fertility. Very specific aspects of our diet, lifestyle, sexual health, and environmental pollution are making it worse. And they are doing it without us realizing it. It's important that you know the following enemies of your testicles, so you can identify them and keep them at bay for the rest of your life. Today I'll explain what the biggest threats to your testicles and fertility are. Most of them are preventable, but there are others that are not. Act on the ones you can and know them all. Testicular torsion. Very, very dangerous. Testicular torsion is a circumstance that causes an alteration in testicular blood flow. It consists of the testicle spontaneously twisting, rotating, and twisting the spermatic cord that carries blood to the scrotum. If testicular torsion is not treated within 3 or 4 hours of its onset, it can cause permanent testicular damage. Ischemia in the testicle due to lack of blood causes intense pain and swelling, and if not treated, you can lose the testicle. It requires emergency surgery. Interestingly, tissue damage due to testicular torsion can be significantly reduced by pretreatment with certain antioxidants. Antioxidants such as selenium, resveratrol, L-carnitine, caffeic acid, and allium sativum extract. This highlights the significance of proper antioxidant intake during high testicular oxidative stress. Although normally when you have this problem, the pain is so intense that you don't start taking antioxidants, but you rush to the hospital. That's the right thing to do. High temperature in the testicle. Any circumstance that increases the temperature of the testicle is associated with increased oxidative stress. This is because at higher temperatures there is less function of antioxidant enzymes such as catalase or superoxide dismutase, while there is greater production of hydrogen peroxide. The testicles are in the scrotal sac for a reason. The temperature inside the abdomen where they originate is too high and they need to cool down. Mother Nature has taken them out of your abdomen into thin skin bags in contact with the outside. Why? So they can be aired out. Spermatogenesis requires a temperature 2 to 4 degrees Celsius lower than your body temperature. That is about 34 degrees. What raises the testicular temperature above what is desirable? Well, wearing very tight underwear, and for example, or frequent and prolonged use of saunas. If you think you have fertility problems or you might have them, avoid both. Saunas, however, have other health benefits that if you want, we can review in another video. Let me know in the comments. Varicocele is a dilation of the veins that drain and remove blood from the testicles. In nearly all instances, it happens in the left testicle due to an anatomical anomaly. I challenge you to describe this peculiarity in the comments. But why does it happen? The alteration of the valves that control venous blood flow is behind the pathophysiological basis of the disorder, although its cause is often unknown. These alterations cause a blood reflux that raises the temperature of the testicle, linking it with the previous point, and that alters the production of sperm. In the most severe cases, it can lead to azoospermia, the absence of sperm in the ejaculate. Surgery varicocelectomy is the most effective treatment. Poorly controlled diabetes, whether type 1 or 2, causes a severe increase in oxidative stress and blood vessel damage. Such high glucose hyperglycemia sticks like gum to vascular and cellular proteins, deteriorating them. The blood supply is also compromised, and all of this greatly reduces fertility. The prevalence of infertility in diabetic males ranges from 30 to 50% in some studies conducted. It's a lot. Better glycemic control leads to improved fertility and testicular function. So do everything in your power to optimize your blood sugar. While type 1 diabetes is not preventable, type 2 diabetes is. Optimizing your metabolism through your lifestyle will make this point not a problem for you. Testicular infections. The testicle is not exempt from getting infected. Testicular orchitis is an inflammation of the testicle with intense pain due to trauma or infection. Among these latter, we differentiate bacterial orchitis from the most common viral ones. Examples of microorganisms are the mumps, virus, or sexually transmitted diseases such as gonorrhea, syphilis, or chlamydia, which can also cause orchitis in males. Not using a condom, having multiple sexual partners, or a history of urinary tract surgery are risk factors. Conclusion: be careful with unprotected casual sex. Hyperthyroidism, which involves the excessive production of thyroid hormones, is a lesser-known cause of infertility. The increase in thyroxine production greatly impairs sperm motility, the ability to move. The causes of hyperthyroidism are varied, with the main one being autoimmune or Graves' disease. Hypothyroidism, even more common, also impairs fertility. A practical approach would be to check your thyroid hormones if you are having fertility problems. Why? Well, because remember that both hyper and hypothyroidism have effective treatment. Imbalance between sex hormones. This point is extremely important. Although estrogens perform important functions in men, which if you want, we can review in another video, an excess of them associated with low testosterone would alter testicular function. In other words, what we don't want is a high estrogen-testosterone ratio. Now I'll explain why. Estrogens exert a negative feedback on the release of two hormones called gonadotropins. The two hormones are LH and follicle-stimulating hormone. High estrogens means insufficient signaling of these two hormones in the testicle. And we need both to produce testosterone and form sperm. Chronic exposure to high levels of estrogens affects the quality of semen, the integrity of sperm, deoxyribonucleic acid motility, and the total number of sperm. That is, it seems that they also directly affect the gametes. In this sense, any disease that lowers testosterone or raises estrogens can reduce testicular function. Xenobiotics. Xenobiotics are environmental toxins that can cause damage to your testicles. We're talking about pesticides like hexachlorocyclohexane, environmental pollutants like tres, 1-dinitrobenzene, or methoxyethanol, and also a series of heavy metals like cadmium or lead that alter sperm production. And of course, in this category would fall hundreds of substances present in tobacco smoke, which generate enormous oxidative stress in the smoker's testicles. Ethanol is also considered a testicular toxin, although to a lesser degree than tobacco. Androgenic anabolic steroids. The use of exogenous testosterone or androgenic derivatives always has a side effect: decreased fertility. When we use high doses of testosterone, LH and follicle-stimulating hormone concentrations are reduced to practically zero, and this leads to infertility that in some cases is temporary, but in others it is permanent. Keep this very much in mind when using these drugs for whatever purpose. So, on one hand, while you're using them, you'll notice an increased libido and sexual potency. But on the other hand, make no mistake, it will be seriously harming your fertility. Recreational substances beyond just alcohol and tobacco are problematic. Cannabis, cocaine, and opioids also alter the quality of semen, and their chronic use greatly reduces your fertility. Obesity. Testosterone is crucial for sperm production, and its excessive conversion into estrogens through the aromatase enzyme can lead to a reduction in circulating testosterone levels. This hormonal imbalance not only affects sperm production, but can also compromise libido and erectile function, which indirectly will decrease fertility. Adipose tissue expresses a lot of aromatase, therefore when it expands in obesity, there is more aromatization and there is more conversion of androstenedione into estrone and testosterone into estradiol. This ultimately leads to an imbalance in the estrogen-testosterone ratio and testicular deterioration. Severe obesity, through central mechanisms different from those described, generates a reversible secondary hypogonadism in which the brain does not send the necessary signals to the testicles to get them to work. Here we are talking about a body mass index normally above 40. Incomplete diet. We cannot ignore the role of diet because, as you know, the antioxidant capacity that your cells have is important to protect the testicles. In this sense, a processed diet will be a diet low in micronutrients such as zinc, selenium, vitamin 100 or E. All antioxidants that preserve your testicular function. Now you know what the main enemies of your testicles are. Protect yourself from them. See you next time. Big hug. Thanks for watching. Keep empowering.